The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon. My name is Jen Saunders. I'm a Senior Program Officer with the National Alliance to End Homelessness. I would like to welcome you to our webinar series on rapid rehousing. We are so delighted to have our speaker, Zach Brown, Executive Director of the West Virginia Coalition to End Homelessness, discussing how West Virginia Balance of State has transformed their homeless system. To begin our webinar, I'll give a very brief overview of rapid rehousing and the core components. As I mentioned, Zach will present on the impressive work that's going on in West Virginia, and we'll have time for Q&A following the presentation. A few housekeeping items. The audio and slides will be posted on our website following the webinar, and please send us your questions so that we can pose these to Zach after his presentation. You should see a questions box within the webinar on the right. Most of you are already familiar with the core components of rapid rehousing, but I'll just give a really quick recap. Rapid rehousing is an intervention designed to help individuals and families to quickly exit homelessness and return to permanent housing. It's offered without preconditions, and the resources and services provided are typically tailored to the unique needs of the household. The core components of rapid rehousing include housing identification, rent and move-in assistance, and case management and services. While a rapid rehousing program must have all three core components available, it's not required that a single program provide all three, nor that a household utilize them all. It's also important to take a broader view and look at how rapid rehousing can transform a homeless system, for example, by reducing wait lists for shelter and capacity demand. The role of transitional housing in a homeless system is also shifting, and we'll hear more about that today from Zach. And with that, I will turn it over to Zach.
Thanks, Jen. Good afternoon, everybody. My name is Zach Brown, and we're going to go through a journey, hopefully semi-quick, and try to get up within an hour of kind of what's going on in West Virginia with our rapid rehousing program. I'm going to talk a little bit about outreach, too, in that our rapid rehousing program here is attached to our outreach, but we'll get really into the weeds on that. So thanks for your time today, and hope you find it informative and interesting. So here we go. Next slide, please. So things that we kind of have to collectively figure out, and what we get a lot of questions about, is how do we find people in a rural context? How do we place them in the housing quickly when in places like a balanced state, or if you're in a really rural community, you got a lot of space and a lot of uneven resources to deal with. So a lot of things will look great on paper in terms of housing people in really rural areas, but what's that mean in reality? And then the big question we get a lot, where does coordinated entry fit into a large rural area? And I'll talk a little bit about that on the side. That's kind of a separate issue, but not really in the way that we do things. So how do you keep people housed in a rural setting? Again, given that vast space and uneven resources. And how can we look at uneven quality in housing authorities, mental health, substance use treatment? I see I have a typo there, I apologize. In terms of how do we deal with this unevenness, uneven resources, and how do we work around that? Next slide, please. So things that we encounter when we're out doing this, largely in the rural context, we travel long distances. We lack resources, and that's not just us, that's any of you that are also in a balanced state or in a rural setting. We deal with lazy support agencies. Man, that's mean, isn't it? But that's the reality of the situation, at least for us, that we can't always rely on people whose stated job is to provide support, sadly enough. We have snow here in West Virginia, if no one was aware of that, sometimes a lot, and ice, so that gets a little sketchy in terms of going out and A, finding people, B, housing people, and C, keeping up with case management. So that's always a challenge. We have woods. We have, I believe, I don't know the stats, I'm just going to wing it, but per capita in West Virginia, we have one of the largest expanses of national forests. So we have a lot of places that are out of the way, very hidden, and that becomes a challenge. So believe it or not, West Virginia is not the most progressive state in all of the United States of America. Therefore, we deal with cultural perception stuff from our community, from our neighbors, from our family. Like, a lot of what we do is working on, okay, what are you guys doing? What is this rapid rehousing thing? What do you mean? You actually do housing first? You put people in apartments without requiring anything? Yeah, and getting around the sort of cultural perception stuff. We deal with a lot of myths and what I will call distractions. And I don't want to derail this conversation today to talk about tiny houses or backpacks for people on the street or giving out soap and socks and transitional housing that, et cetera, that we think works. But these are myths. These are things that distract us from really what we need to be getting at, and that's the core stuff that works. So we've come down far enough the road at this point, I think, to be able to make some definite assumptions about what's working and what's not, and we'll talk about that a little bit today. Even for sort of old war horses like myself that have been doing this for quite a while. For instance, I used to develop transitional housing. Making those changes in perception and framing the world anew can be difficult for a lot of people, so we deal with that quite a bit. Next slide, please. So, dig, if you will, this picture of West Virginia. We have 4 COCs in West Virginia. Don't ask me why. I'm not exactly sure, but we do. We historically always have had at least 3. And then right around 2003, the Balance of State COC was developed. So you see generally the geographic layout there. We are the lead for the Balance of State COC in West Virginia as a coalition. And that's our area. So we have about 44 of West Virginia's 55 counties, and it's a mix of, you'll hear me use the term urban-esque. I don't think I've made that one up, but I use it a lot. So urban-esque areas, not what a lot of you would call urban, but certainly more populated with more resources, and then super, super, super rural places, and we'll get into that. So we are the state coalition for all things homelessness, education, advocacy, et cetera. In West Virginia, we're the lead for the Balance of State COC. Sorry, we're the lead for HMIS for the Balance of State COC. We are the SOAR state lead, if anybody's familiar with SOAR, and that's getting people on SSI, SSDI quickly so they can get income and maintain their housing. And then we also are a direct service provider of ESG, rapid rehousing, and Path Street outreach in about 22 of our counties in the Balance of State. So we don't cover the entirety of the Balance of State, but we cover at least half of it. And we also were recently awarded a COC rapid rehousing program, so that's going to add to the arsenal bit, to the quiver. We are believers in being cool as possible, housing first, failing and improving, and I'll talk a little bit about kind of areas where I feel like we have kind of fallen down, failed, and got back up and refined things. And just because I'm doing this webinar today doesn't mean that everything's perfect in what we're doing in outreach and rapid rehousing, or coordinated entry, or anything else for that matter. But that's also okay, and that's going to be a little bit of the message today. Like, it's okay to go try stuff and do it badly, and then refine it, and then go back out again. And what's important is that you're doing stuff. So, next slide, please. So what we believe, and a lot of you would think along the same lines, homelessness is incredibly costly and housing is much less so. We know that. We believe that anybody can be housed. A lot of people get shocked by that, but in our experience, anyone can be housed. It's a matter of persistence and time and the way we go about it. We have to focus our limited resources on those who require it the most. So we hear a lot about this out in the world, but when you're doing direct service, this is really where that is not a conceptual thing. That is something that we really believe. Therefore, we tend to target in our direct services the highest need folks. We'll talk about that. Homelessness is not a punishment. Housing is not a reward. Hope that we are all in belief of that. And the only solution to homelessness is housing. So anything else that distracts us away from housing is something that we really need to stop, or at the very least, seriously rethink. So you're going to hear me say housing focused a lot today. You're probably going to get sick of hearing me say housing focused a lot today, because that's kind of where we come from everything in terms of our HMIS, how we look at things as a COC, how we deliver our direct service, how we do our outreach. So next slide, please. So what we use, these are things that are in the quiver as we're doing rapid rehousing and as we're doing outreach. So We do use ORCODE's BI SPDAT triage at intake. So that's everybody. Everybody in our system uses the BI SPDAT. That's the first step for all. We use a housing prioritization list based on the BI SPDAT score. So housing prioritization, by name list, all talking about the same thing. That's what we use. I'm going to show that to you today, at least a screenshot of it, so you get a sense of kind of where we're coming from. We use full SPDATs for case management. So again, ORCODE's tools, the triage kind of informs overall, provides the same vocab for the full SPDAT, so we use those for case management. Particularly important in the context of a rural area and as much territory as we cover. Using the full SPDAT for case management helps us really target on what we need to target it on and not kind of do a lot of guesswork. HMIS is very much the backbone of everything that we're doing throughout our COC, our direct service here at the Coalition included. So our list is pulled from HMIS. We share information through HMIS over a vast area that's really rural, that you're traveling a lot. Using that technology at this point is almost, it's part of how we hold the whole system together. And we do continual training as a COC and guidance on our list. So our actual prioritization list, and why I left this in here, put this in here, is that I'll talk a little bit about contextually how our direct service staff help enforce and reinforce what we're trying to accomplish as a system. So they're there as a face from our staff that is giving kind of one-on-one assistance as they're actually doing direct service. So, and we tie our prioritization and our COC to funding. So taking a part in prioritization, leading prioritization in your community, that becomes something that becomes part of your COC funding profile as we go forward with our HUD competitions. Next slide, please. What we use in our direct service, we do VS, but that's for everybody, like we do in the rest of the system. Those feed to our prioritization list. We do there's housing-driven outreach. We do progressive engagement and rapid rehousing. So if you don't know what progressive engagement is and you've not looked up some of the rapid rehousing resources on NAEH's website, progressive engagement is basically, in a nutshell, we do not provide sort of the whole enchilada to somebody as they come through the system, but we look case by case at what is the least amount of assistance we can supply or apply to the situation that's going to be the best success for the family or the individual. That's not like we skimp on case management. We don't do that. I don't mean that. I mean, we look at, from a housing subsidy standpoint, what's this family need and what's this individual need, versus just saying, having a standardized, like, we give out this much for 6 months. So nothing that we do from that standpoint in assistance is standard. All assistance is on a case-by-case basis. So we do housing first as a philosophy. And Jen touched on this a little bit, but housing first is basically accepting folks into housing without any preconditions of sobriety or income or behavior, et cetera, et cetera. And we are very much a housing first rapid rehousing program. Full SPDATs for all case management, thought and care and geographic coverage. So we're not sort of aimlessly walking through the woods. There is a rhyme and reason to everything we're doing. We schedule things. We're as specific about targeting as we possibly can be. And we work around broken systems all the time. So we know sort of what that means, I think, collectively on the call. The systems that we have in place within our communities, that some work. So you get along with the housing authority in community A, you don't in community B, because we're covering a vast array of counties. So the community mental health is great in county A, not so much in county B. So we have to work around those systems. And then we try things, we fail at them, we reassess and we refine what we're doing. And sometimes it's a game of inches. It certainly has been over the past few years, but what we do is we try to keep our nose to the grindstone and improve what we're doing, but we're not afraid to fail. Next slide, please. So we're looking at things at the crossroads of good outreach, rapid rehousing, and system improvement. So I talked a little bit about how us having staff and being on the ground in our own continuum of care delivering resources, that gives us some ancillary benefits. So these are a few of them. So I say, sort of tongue-in-cheek, congrats, you just proved housing first works. What I mean by that is, for years we were coming from the standpoint of, please do housing first, it's what works, It's how you're going to be able to help people to the best of your ability with your funding, the limited funding you have. Saying something and doing something are entirely two different things, as we all know. So being out and doing it provided sort of a template of, oh, wow, they weren't nuts. They're actually doing this. They put their TA where their mouth is from that standpoint. So congrats, you just proved prioritization by acuity work. So we use the VI SPDAT as a triage. We are prioritizing people by their acuity score. We are doing that in the rural areas when we are the only game in town, proving that it can be done, and it does work. Again, I don't know about your community, but in West Virginia, people don't tend to accept things here from the outside until it's actually proven to work here in West Virginia. Oddly enough, that's an odd thing when you're looking at actual data, but we are putting boots to the ground showing that this stuff works. So congrats, your PIT just improved. So we're moving and grooving in all these different counties. We're getting to know the service providers. We're getting to know the housing authorities. We're getting to know the beauty shop, the postal worker, the volunteer fireman, and guess what? Suddenly they know who we are, and we can go out in January and say, hey, or before January actually, and say, hey, we're doing the PIT. Would you like to take part in that? So that has, this past January, we had the biggest coverage that we've ever had, the largest amount of coverage in the 44 counties ever on our point in time count. So we had about 32 counties out of our 44, which before having 15 or 13 counties was sort of a coup for us, and we had to extrapolate everything else. So congrats, you just saw more organizations to be involved with the COC, the HMIS, et cetera. So as we put boots on the ground and went out into our communities with direct service, all these people came out of the woodwork that we didn't know existed before. Because as a COC, you can go in and you can monitor somebody, and you can be in a community, but mostly you're kind of hanging around HUD-funded folks. In this case, we're getting to know a little bit about everybody, which is cool. So congrats, you just reduced homelessness in part by 70% in your COC. So that's what we've dropped from last year to the most previous point in time count. I'm not going to say that that's entirely the credit of our rapid rehousing program, but I think that's certainly part of the credit of that. Plus, we have kind of provided a template for other organizations that were getting ready to change to make the difficult switch from kind of first come, first serve, or not doing housing first, or not rethinking their system, kind of traditional services, to actually giving them sort of, I think, a certain amount of confidence in being able to make some changes. And I think that's definitely had an effect on our ability to reduce on-the-street homelessness. So, and congrats, you actually know what's going on in about 3/4 of your community. So that's kind of where we are right now. We still have some question marks, definitely in our COC, because we have a huge area we've not covered at all. But we know a heck of a lot more than what we used to because we're out in person on the ground. Next slide, please. So the VI SPDAT, if folks are out there aren't familiar with that, that's the tool we use to determine acuity based on a history of housing and homelessness, risks, socialization, and daily functions wellness. I won't belabor this too much, but if you want to look up Org Code Consulting, you can read all you want to about the VI SPDAT. It helps us identify the best type of support and housing intervention for permanent supportive housing, rapid rehousing, and diversion. Whereas before we basically worked on hunches and guesswork, now we have kind of a palette or a template to go from in determining kind of where your next best fit might be. And these days with the updated stuff, we're using 3 separate tools. We have one for individual, we have one for family, and we have one for youth. And I believe 2 of the 3 of those are in our HMIS right now. 3rd is coming quickly if it's not in already. Next slide, please. So housing interventions. In the places where we have a prioritization process, we are feeding the list as an outreach provider and a rapid rehousing provider. What I mean by that is in the urban-esque places I mentioned before, the places with more resources, we simply are there at the table adhering to our own process. We're the outreach, the street outreach, feeding people into the system, and we're one of the rapid rehousing providers at the table. In really rural areas, we are prioritizing our own clients and housing people. So if we're the only game in town in a given county, we may be doing, there's no shelter, there's no PSAs, there's not much of anything. We can refer from one county to another. I mean, we are doing that, but in many cases, we're also housing the people we find through outreach ourselves. So Sometimes we go outside the stated process when people will not house high acuity people. So if we're in one of these urban-esque areas where PSH won't take somebody, or SSVF won't take somebody, we don't wait. We certainly make a record of that, but we don't wait. We try to, when we have enough money, house people on the quick. So we generally target high acuity people and have rapidly rehoused many chronically homeless people up to this point. And everybody can have the collective gasp of the lack of wisdom in rapidly rehousing chronically homeless people or high acuity people. But we have found, we first did it out of necessity. We've found that it does work. There's caveats to that and some ways you have to handle it, but it certainly has worked for us up to this point. And again, in many cases, we've not had much of a choice. So there's that. Next slide, please. So I'm going to show you our list real quick. I won't belabor this either, but this is our by name list. This is what pulls out of the RHMIS and goes. Actually, it gets sent out to everybody every Monday morning. This is the first version of it. So it was a very simple acuity-based list, very Germanic in its color structure, but basically give you an idea of what was the client ID, client name, were they chronically homeless, were they a veteran, what was their income, what was their VI stat score, what was the date. So this is the list that everybody uses, our direct service staff plus everybody in every community in the balance of state. That's version 1, pretty simple. Next slide, please. Version 2, just to show you this, we start to refine things a little bit, and we start to look at the concept of inactive clients. And we've changed a little bit of this since then, but you see it's very yellow. So that's where we're starting to look at tracking people who are inactive for our 6 months. So starting to look at not taking people off a list, but being able to tag in such a way the number of people who were inactive. And that's the version 2. Next slide, please. Version 3, getting crazy fancy with the colors now. So this is when we added in both the individual VI SPDAT and the family VI SPDAT, and we were trying to figure out a way to start looking at both of those scores and make it in such a way that was easy to understand for staff and easy for folks who were prioritizing their community to understand it. But it was a little wide and it was a little wonky. One thing we don't try to do, and we get this question a lot with our list, is we're not trying to make a really long list. We try to keep it as simple as possible. Our COC guidance, which you can find on our website, wbceh.org, you can find where we outline and what happens in coordinated entry in terms of the guidance on, for instance, chronic homelessness. So all that's contextually put out to the world in our guidance that's not handled on our list itself. So next slide, please. And ta-da, latest version, although I was told this morning there's been some tweaks made to this version. So as in all things we do, they're living stuff. Nothing's ever kind of ultimately perfected. But this is, again, a simplification of the list in and of itself, looking at the individual VI SPDAT and the VI SPDAT for families, and having that kind of down in the same column, so you can easily look at families versus individuals and prioritize in your community, or we can prioritize our own clients. So kind of the next step that's going to come from this is also using the youth VI SPDAT, and that'll be a separate prioritization on a separate tab. It will not be in with these scores, so we're going to handle that in a completely, not a completely separate way, same way, but kind of a different take on that. So that's our list where it is. Next slide, please. So our visual process, I just redid this nifty graphic, but an individual, family, or youth presents for shelter or encounter during outreach, and this is what happens for, this is what our staff use, and this is what happens out in the world for any community. So the individual VI SPDAT, family VI SPDAT, or the youth VI SPDAT is performed in HMIS. COC-wide prioritization list is sent out to all users in HMIS on Monday. Now, those users then can drill down to their individual county. But everybody gets the COC-wide list so they can have some contact, see potentially somebody who's been in another area that showed up in their service system. They can drill down and do that, so they all get that. And I talked about youth will be separate. Then then based on client choice, so all of our providers that are on the table, SSVF, ESG Rapid Rehousing, the COC, PSH, and Rapid Rehousing folks, transitional housing, the shelters, hopefully community mental health. So everybody sits around who has a housing resource, and based on client choice, they talk about where the potential next step is for the client on that list based on these acuity scores, based on the VS-FDAP they got. And then hopefully they're going to be referred, moving quickly. And then that community goes back to the list. So this works in some places great, some places better than others. But for the most part, this is a system that we've refined, are still refining, and it's working fairly well for our communities and for us in prioritizing our own clients right now. So again, we play kind of a dual role. More populated area, we're at the table. In a place where we're the only game in town, we're doing the prioritization, and then we're doing the outreach prioritization and the housing. Sometimes the referral if we can. Next slide, please. So why did we do rapid rehousing? And we get this question a lot because originally we were just an administrative organization, just a COC, just an HMIS. So people were dying on the street, and I was, as you may understand, pretty uncomfortable about that, being the leader of an organization that has End Homelessness in its title. When we started doing the VIS for that, we could then see we had a lot more mid-acuity rapid rehousing folks than we first anticipated. So that was kind of a no-brainer in that we need to think about something in terms of a subsidy. A lot of our programs wouldn't take high-need people. A lot of our shelters, a lot of our PSH at that time, a lot of our folks would not take higher-need people. That didn't set well with me either. We needed flexibility. So in a rural area, you really need the kind of flexibility, the kind of housing subsidy flexibility that allows you to house people 2 counties over, in that county, etc. We were ready to go mobile. We needed to go mobile. So our direct service staff do not have an office per se. They spend time out on the road. They have kind of centralized places where they can stop, do anything in HMIS they need to do that they couldn't do on the road, etc. But by and large, our folks are out and about, and that's pretty important, and that makes us pretty unique. Unfortunately, in our COC, there's a few other agencies that spend their time out and about, but we are out taking our services and our assistance to homeless people who are out there homeless. We are not doing VI spit out hours on Tuesday from 1 to 3 on the other side of town. We are taking services to them. And that's important, and that's the only way you're going to find the people that really need the services and the housing that we are providing. And we try to swim through this is very poetic, swim through our urbanesque and rural landscape like fishes through water. So we are now part of the system ourselves. That's incredibly informative to us about what we're doing great and what we're not doing well. If we can't get people housed through our own system, what do you think that tells us as a continuum of care? It tells us a lot. It tells us where we need to have a lot of things fixed. So anyway, next slide, please. This is another visual of the process. It's basically the same thing I talked about before. VIS stat is performed. The client is diverted, referred to other housing, triage in a shelter or hotel motel if we're lucky enough to have an agency that has vouchers. And then based on acuity and geography, they're housed. And a community with an existing structure, we're part of it. And then once people are in the housing, we try to do that quickly. If it's a referral or through our own housing, then the services start. So we lean on our health clinics. We have a few federally qualified health centers that are really helpful. Our integrated mental health system, again, uneven. In some counties it's great. We have a great relationship and they really help out. In other places, not so much. Community action agencies, faith-based groups. So this is only just a smattering of kind of who we rely on to help us get done what we need to get done. Next slide, please. So rapid rehousing, and Jen already pretty much covered this, so I'll be real quick about it. It's a way to quickly house people from street or shelter. You're talking to ESG has a type of rapid rehousing. COCs now have a type of rapid rehousing. Supportive services for veteran families or rapid rehousing, and a lot of states have state funds for rapid rehousing. We are not lucky enough to be one of them in West Virginia. So again, for rural or urban setting, provides a flexible housing subsidy, which has really worked well for us. Putting people right into an apartment is basically what rapid rehousing is, from the street or from a shelter. And moderate to intensive case management. I would say in most cases it's moderate case management, but we do intensive case management with a lot of our folks because they have the kind of need that warrants it. Next slide, please. So what did we have to do when we started out kind of down this road is we really had to prepare the ground. So we had to scope out where we were going to go and investigate. So from that standpoint, I mean, we had to, at the very outset, kind of get to know people in the different communities. And we had a few surprises. And for instance, in a couple of our counties, we had gone there and we had done, tried to do a point-in-time count with them, found nothing, et cetera. So we made assumptions previous to providing outreach and rapid rehousing that there weren't any homeless people in a given county. What the reality came to be is that once we had people on the ground making relationships in the community, we started to find homeless people in many of the counties where we would assume there weren't anybody. And we actually, in one of our counties, housed probably 15 people where previously we had no clue there was anyone. How is that possible, you ask? I think being on the ground, making relationships, getting to know people, and getting to know where people are hiding makes a big difference. Again, that person-to-person involvement. So we started with the populated places first because that was easier. That's where we could start to kind of hone our experience, get to know what we were doing both in outreach and rapid rehousing, and then we started to cast out into the more rural places. In the rural areas, we make connections with law enforcement, with mental health, with nonprofits, post offices, businesses, pretty much anybody. We get to know kind of the lay of the land. And we became known. So having people on the ground has another ancillary benefit in a rural area, in that now everybody knows kind of who the coalition is other than just a name. They can attach a person to the situation. So they know who we are, they've been educated on what we're doing, and they know where to call if they do see someone, find someone, etc., who needs housing. And we spent a lot of time initially introducing ourselves to landlords. So part of getting to know folks in a really rural community is that someone's going to know somebody, or somebody's cousin knows somebody, or is a landlord, etc. And we started to make those connections. We did do the traditional stuff like showing up at, landlord association meetings. We did stuff like that. But over time, we started to cultivate kind of a revolving cadre of landlords that were willing to help us out with what we were doing. And that was really important at the outset. So we thought about that at the outset and started to really focus on that, knowing that we were most likely going to find people and we were going to need to rely on them. And we did. Next slide, please. So what we've encountered in our experience, and this is more sort of an anecdotal look thus far, and we have data on this as well, but we have found a lot of people with mental illness out on the street and out in the rural area, so kind of more than what we would have made the assumption we would have found. We found more chronic people than we really expected, and I'm not sure that we had an opinion of what we would find before we went out. I put Get Ready to Rehouse because we have to rehouse people. This is one of the upsides to the flexibility of rapid rehousing, is that something's not working in a certain situation. We have had situations where we have to move people from a place that has an absolute lack or dearth of resources in terms of mental health or substance use, and move them to a more populated area where there are more resources. And that's not always what we want to do. We want to try to stabilize people where they are, but we do have the flexibility to move them when we need to if it's in their best interest and it's something that they want to do. And we've done that in a couple places. I talked about people. We found people in places we didn't think there were people, and that's just part of being on the ground. We've encountered that we need more rapid rehousing money, and we've started to fix that. So we are housing more people than, we are finding more people than we are able to house up to this point. But that's bad, and that stinks. But at the same time, we know kind of what we need to project in terms of meeting the actual need. So before we would make assumptions about kind of, oh, gee, I don't know how much we're going to need, let's ask for this number. Now we really have kind of a bead on exactly what we're going to need. More money for outreach. Outreach has been, street outreach for us in West Virginia, in my opinion, has been absolutely fundamental. For us as a continuum of care, it's been absolutely fundamental in informing us of what's actually going on versus kind of the assumptions and mythologies we had about the situation. So, we definitely need more money for more outreach here in West Virginia. I think that connection is the only way we're going to make any real progress. So that's it about outreach. Next slide, please. The pro tips, managing the process. This is just me. This is just sort of like Managers Act talking here and how I go about it. So part of what I've tried to do, we tried to do here is hire appropriately for this job. So a couple things. We don't consider outreach and rapid rehousing or case management as an entry-level job. I think there is a real tendency in our world to look at this as the lowest rung job, and then if you do well there, then you move on to something else. And sometimes we don't think that's necessarily the way to go. We're all, number one, equals in the way that we're trying to attack the issue, and we want skilled people out helping make decisions for the fate and the lives of folks that we're encountering. So you don't really want the lowest rung folks doing that. So hiring appropriately also means, from the standpoint of, sure, we're looking for credentialed people to have some sort of experience, but that's not a make or break thing. What is a make or break thing is if you have a dedication to doing this, if you're willing to go out, if you're already in the pocket to at least understand and believe the importance of housing first, that sort of thing. Anything else we can pretty much teach you as we go down the line. So the team is key, not you. So all things being equal, and what we should be doing on this webinar today is my folks who are on my team should be telling you what they're doing versus me, because it's not me doing this stuff, it's them. So I think we have to be super humble and super understanding that the folks that we're sending out to deal with these issues, they're dealing with a really hard job, and sometimes I have to check myself and remember that. So this is really anything I'm going to show you from the standpoint of the success of what we're doing. This is just like communicating the process and letting them go do this thing well. And that's when we come to, I fully explain the why we're doing this and what the expectations are. Provide all the training that we possibly can in background, and still doing that, still training people as we come on. But this has to be decentralized in a huge area like we have. It cannot be micromanaged. There is absolutely no way in the world, given the huge area that we're covering, that I could know everything that these folks are doing every second of the day. So I have to handle that on the front end, and who I hire, how we train them, what their understanding and expectation is of the job, because I'm hiring them to go out and do a really hard job. I need them to get that. And then we adjust things as needed. So, if somebody needs more training, if they need guidance in a certain area, so we try to bring outside eyes in as much as we can and as much as we can afford to be able to take a look at what they're doing from the outreach and the rapid rehousing standpoint and the case management standpoint and say, is this what we need to be doing? Are they doing it well? Do we need to readjust? So a little bit of tip for me on the managing of the process. And again, it's not perfect, but I have really good people, to the point that when we do run out of rapid rehousing money, when we do get to the end of the line of our subsidy money, they're clamoring at me like, when are we going to have money? When are we going to have money? We're ready to house people. That's an indication of probably you hired the right people, in my mind. Next slide, please. Here's the real stuff. Here's all outputs. This is what everybody wants to see on a webinar. All right, so we're going to show it. So between 7/1 of 14, 3/21 of 16, not too long ago, ESG and our PATH outreach have contacted about 250 people over those 22 counties. Our average cost to house a PATH client for us, and this is just a fun fact, for rapid rehousing out of our own PATH program, is about $1,600 per person, which isn't too bad. Last year we housed about 12 of our PATH clients of our own that we'd found on the street. Since inception, we've rapidly rehoused about 25% of our PATH clients, about 71 rapid rehousing clients out of 279 PATH clients. And this is, in about not quite 2 years of doing this. Next slide, please. Here's where we're getting to the awesome graph. So you can see about 62% of everything we're doing in our expenses is rental assistance. We have a little bit of application fees, security deposits, etc., utility deposits, but and some utility payments. But by and large, we are focused on rental assistance. So this is probably a good place to bring up also. We don't do prevention. We just opted not to do prevention. We're not big believers in prevention at this point because, quite frankly, we have plenty of people out on the street to house before we start talking about any kind of targeted prevention. Now, we are talking a lot about sort of targeted informed diversion as its own service, but in terms of actual what we think of as prevention, as in, hey, you're going to be homeless, I'm going to give you some money to stay in your housing. We're not doing, we as a program aren't doing that. We are doing only access and housing of people who are literally homeless. Next slide, please. Another graph. Let's blow through this because we're not going to have time for questions unless I speed it up. This is our acuity scores in terms of data. So about 54% of our folks are in the rapid rehousing acuity. About 41 would be in a housing first or PSH acuity. This is amongst our rapid rehousing clients. Next slide, please. This is the real stuff. This is the good stuff. This is where we have improved. So we have gone average time between intake and start of service delivery in our program from 13 days in 2014 to about 4 days in 2015. So that's cool. That makes me happy. Average time from intake to permanent housing placement's gone from 15 down to about 7 days, and average length of stay in our program on rapid rehousing has stayed roughly the same, a little bit more in 2015. So as we plan for the future, we need to get a lot better at projecting our rental assistance and a lot more relying on the data to be able to do that. We really want to expand to new counties to figure out what's going on in some of the counties that we've not even touched yet. Holding the organizations responsible for helping us out in terms of referrals and support stuff, and basically if they're state-funded organizations, are they doing the thing that they said they're going to do in helping this population? Simplify and simplify and simplify. We're always looking to our own stuff, our own barriers, our own bureaucracy, our own paperwork. What can we take out to make things a lot simpler? So we're always thinking along those lines and staying on the move, going out, being out in more counties, contacting more people, making more relationships, and then working around the obvious problems that we run into. And we're getting better and better at that over time. No less frustrated, but better at doing it. Next, and I believe last slide, this is me. That is my email. Feel free to email me. This is the coalition on Facebook, Twitter, and that is our website. You'll find a lot of stuff on our website. So do not be shy. Feel free to reach out. Now I believe we will take questions.
Thank you so much, Zach. That was great. We have a few questions that have come in. The first one is, could you tell us a little bit about key factors that have allowed your rapid rehousing programs to successfully house high-need populations like the chronically homeless?
Okay, I think a couple of things are fundamental to the way we've done things in that standpoint. I think successes are really the trick in a nutshell, and I'm oversimplifying things a little bit, but amongst the higher need people, the real trick is, for us, it's been getting folks either, if they're already on SSI, SSDI, that's great. If they're partway through the process, taking that to the goal of making sure that they are on, but basically however we can, or either using sorting if they have done nothing, but figuring out how we can get as much income to bear for them as possible. Not just SSI, SSDI, but I mean anything. SNAP benefits, anything that may be due them that they've not gone through the process of getting that. So as much as we can get income going towards them, it doesn't mean they're not ever gonna work. Maybe they will, but our goal is to stay focused on the housing part, at least initially. So what can we do right at the outset to make sure that they're going to be able to pay their own rent someday? Because with rapid rehousing, we are on that time clock, and that's what makes people so squeamish about, you know, higher need or chronically homeless people in a rapid rehousing situation. But really, you're doing the same thing that you would do for any client, and that you're trying to make sure that they can have enough income to pay the rent and stay there. And then really the harder part becomes, at least in our experience, the kind of support stuff. And that's where the unevenness in community mental health help, the unevenness or the extremely long wait list here in West Virginia, and I'm sure everywhere, of getting the substance use treatment, et cetera. Those become ultimately more of the challenge than the actual people staying in housing, believe it or not. So hope that answered the question.
Great, thank you. Are PATH clients coming directly from the street? Are they unsheltered?
Yeah, street. So we're doing like actual street outreach. Like, we're not doing the stuff that people talk about in terms of inreach. Not a big believer in that. Not a big fan of it. Again, because we have plenty of people living outside for us to spend our time on. We'll stay plenty busy just finding people who are out on the street. That's not to say that we don't assist folks who are in shelter. We certainly take some people from shelter, but our outreach is pure street outreach.
Thank you. What would be needed to rapidly rehouse the remaining 75% of past clients?
More money, more people, more time for the number of people that we have out there. Now, I should put a caveat on that data. It doesn't mean that those people weren't housed. What it means is that we looked at the data, cross-referenced who were coming in at our own rapid rehousing. They could have very well been referred to PSH or another rapid rehousing program or another or an SSVF program, depending on where we were. And I can tell you one place we really need to get better, that I hope that we're working on now to get better over the next couple months, is our data, which I know sounds weird because we're also known for kind of being very HMIS fluent, but we need to get a lot better on the back end of pulling out the kind of reports where I can show you guys, like, and show ourselves of exactly what is the impact. You know, what is the impact of what we've done in the rapid rehousing to this point? What's the impact of our path outreach? You know, how's that influenced things overall COC-wide? How's that influenced the PIT count? Starting to look at some cool stuff like that. But right now we're in that projection of what would it take, based on what we know to this point, to really take our rapid rehousing to scale and make an impact. Or the other thing is this has influenced and helped a lot of other folks who are doing rapid housing see, well, maybe could we use your model? And we have done that. A lot of people have reached out to us like, can we try this the way you're doing it in your program? Other agencies in our COC. So that's part of taking this to scale as well.
Thank you. What does the housing you place clients in look like? Is it mostly apartments, rooms, and detached houses?
Apartments, almost 99% of the time, apartments. And wait, the next question in my community we have really low vacancy rates. Well, we have really low vacancy rates here too, and that's something that comes up all the time. You got to get out. You got to get out. And you find. I mean, we have some counties that I would say we have one county that I can think of right now that we've been in, and it's very difficult to find an apartment. It just is. Don't know why. They're not there. It's not that landlords have an unwillingness to work with us, but we have worked long and hard to cultivate a landlord base, even though we have just as much of a lack of affordable housing as everybody else does. That's a reality. It's not an excuse to not go and do it, not go and look for it.
Great, thank you. Can you talk about efforts you've made in your coalition to convert transitional housing to rapid rehousing?
Yeah, actually, we've not had a lot of conversion of transitional housing to rapid rehousing, and I'll tell you why. We have had some transitional housing programs that have been defunded, where the money's going to go back on the table, and some new rapid rehousing has come out of that. But in terms of retooling, it's difficult here in West Virginia, and probably difficult in a lot of places. Any of our retooled transitional housing has become permanent supportive housing, just because we have a lot of kind of old school congregate project-based transitional housing. So there's been more of a move towards those becoming permanent supportive housing than they have been rapid rehousing, because you have a building involved. Now that's not the case in every case, but that's the case in most cases. And after the last competition, we only have one transitional housing left in the entirety of our COC. So, in terms of HUD funded.
Thank you. So this is a comment on the impressive outcomes that you showed on one of your slides. How are you able to house people so quickly?
A lot of that comes from later on, after we've done the legwork and really our rural communities and in the communities where we can't get anybody else in the housing. As long as we got subsidy money, we've already set up kind of in most of our communities kind of a first choice, second choice, third choice basis of housing. So I don't think it's any magical we've done into that. We've gone out and done outreach, and we're able to have in hand a subsidy of some sort, that if I can't get somebody in some other kind of housing, or if I'm in a county where there is none, if they're willing to go right then and there, we'll go, because we already have everything lined up. We're pretty quick with our paperwork and have that set up in such a way that we can be fast. And again, part of it is the trust of the folks I'm sending out to do this. You know, they know what they're doing, and we let them do it. And that's why we've been so, I think, so quick in our housing. And it's awesome. The first time we housed somebody in like a day was awesome. Like that was like, okay, we're headed in the definite right direction. And that's not everyone, so don't take it that way. But sometimes it takes longer, but it's as quick as we can possibly do it. You know, on the flip side, there's been places where we've not housed somebody as quickly as we should have or could have, and we paid for that in the past, and the loss of life, etc. So there's the other side to that coin, but that's also pretty good motivation to get a lot better and a lot quicker in housing people very quickly.
Great, thank you. Many places around the country just received new funding to start rapid rehousing programs. What's your advice to these folks who are just getting started? What's been the most difficult part for you, and what's been the greatest benefit?
I think at the outset, I think you need to lean on kind of the best information that's out there in terms of how you should go about rapid rehousing. I think you need to frame, why you're doing it and what you want it to look like, what you want it to achieve. I had a pretty good idea from the get-go of what I hoped it would achieve in our communities and in our continuum of care, and I think we're about halfway to achieving what was in my head. But I think you have to rely on a couple things, like here's a plug for Nationalized End Homelessness, a lot of great rapid rehousing information, USICH, lots of great rapid rehousing information. Lean on Org-Co Consulting, lots of great rapid rehousing information. Look to other programs that you admire that are doing rapid rehousing really well. That's what I did. Because I'm going to date myself a little bit on age, in terms of age, but you know, I come from a back in the HPRP days. I used to run former agency I was with, their HPRP program. A lot of youngsters don't remember that, but that was kind of flying blind. I literally relied on something that was posted on NAEH to figure out how I was going to do it. Didn't do it well. Learned a ton of lessons though. But I think the biggest thing, don't be afraid to try things. It's not going to look exactly the same in your community as it does here, and it hasn't even looked how we thought it was going to look once we started to go out. So just assume that it's not going to be perfect. Your goal is, in terms of your system, is not to be prettier. And I think that's where we lose our sight in anything we're doing programmatically sometimes. It's like, well, we want this to be pretty and perfect. And it's not going to be. Your goal is that this is going to be better. You know, it's going to be faster. It's going to be a lot more efficient and a lot more effective. And think about how the best way you want to do it, and provide an example for, Lord forbid, if you have any resistant agencies around you. Show them that this can be done. You know, try it. And they will be waiting for your first foul-up or your first failure or your first somebody falls out of housing. And if that's the case, you just refine what you're doing. Get back up. You don't stop. So that's kind of my best, most colloquial advice. Try it. Learn as much as you can and try it. Do not spend a ridiculous amount of time planning out your next step. And that doesn't mean don't do planning. I'm not saying that. I'm saying get out there, start figuring out what's going on in your communities and where this is all going to fit into the puzzle.
Thank you. Do you use, or do people stay in emergency shelter before they are rapidly rehoused?
Sometimes, not always. We only have 10 emergency shelters. Well, we have 10 contract shelters in the state, and a few, like a smattering of faith-based shelters. We don't have shelters everywhere. So that's what I meant when I say that we're in the only game in town. In some places, I mean literally we are the only game in town. Like, we are the only housing resource. There's no shelter. There's no other rapid rehousing program. There's no vouchers. There's no anything. There's certainly not shelters. So sometimes people are in shelter, and we've housed people out of shelter. But more often than not, there's going to be another rapid rehousing program in that community where the shelter is, and we let them handle that. By and large, it's not to say we don't do it, but by and large, we're out, you know, in the sticks and in the rural areas and providing the housing where there is none, more often than not.
Thank you. To what extent are you using rapid rehousing as a bridge to PSH for high acuity folks?
Not a whole lot yet in some very specific cases. And actually, at the outset of when we were doing rapid rehousing, we didn't know for sure that you could do it as a bridge. On the HUD side of things, we knew SSVF worked that way to a degree, but we've done a little bit of that. Part of the problem, quite frankly, in our COC is that only over the past, say, year and a half, 2 years, and this will make some people mad, and I don't really care at this point, but it's been very difficult to get high-need people into our permanent supportive housing programs, and we're changing that. You know, if you're not willing to take the type of folks who are struggling with the type of things they are into the type of housing that it was meant for them, then you're probably not going to be funded for very long. So from that standpoint, that's been one of our biggest sticking points, and really historically one of the reasons why we finally elected to do rapid rehousing or elected to do direct services, because we were running. I was not going to send outreach people out to refer nowhere or to run into the kind of frustrations we'd run into up to that point. So somewhat using it as a bridge, I see as things systemically improve, we'll do more of that, but we're kind of on the very front end of doing that at the moment.
Thank you. I think we have time for one more question. Can you talk about the number of outreach workers that you have and how big an area each worker is responsible for?
Oh, yeah, I didn't really hit on that. Sorry, that was my fault. Yeah, right now we have 4 total staff, about to add a 5th one. So we have 2 folks over in our eastern panhandle of West Virginia towards DC. They're working primarily in and out of Martinsburg, West Virginia, and in some of the neighboring counties. I won't say that they don't go out into the rural areas, but we have a big enough issue there in Berkeley County in West Virginia, because it's kind of a bedroom community of DC, that the volume has been such that they've concentrated mainly on that area. So 2 people over there, and then we have 2 people here so the 2 people over there, to specifically answer the question, probably mostly stay in 2 counties and can go out to 5, 6 counties. We've not really gone out into the super rural areas there, in that it takes a long time to travel, and we've been dealing with the immediate problem. Over here, I'm in the north central, and our main office is in the north central part of West Virginia. Think about 16, 20 miles from the PA border. We have 2 people here, and they travel throughout probably the largest collection of our counties. They go, I don't know, I'm thinking number-wise around 13, 15 counties. So they really have to schedule things out in terms of where we're doing outreach that day, where they're going to stop and do case management. So they have a much, I want to say a larger job, probably about the same job in volume as our Eastern Panhandle folk, but much larger area to cover. And then we're going to have another person, so we'll have a total of 5 folks coming on when we get COC rapid rehousing up and running, and they're going to handle a whole other spate of counties. But we're super flexible with that, and we have areas and needs that we've not even covered yet. So the southern part of our state, southern West Virginia, for those of you who think Hatfields and McCoys, we've not even begun to kind of unravel the problems there, and it's going to be a lot of thinking, because it's a long way away and really high needs. So.
Well, I think that brings us to the end of the webinar. I just wanted to thank Zach for the great presentation. This is so interesting. And our plan is to post the webinar and the files on our website, endhomelessness.org, either later today or tomorrow. We do want to mention that there's another webinar coming up on June 14th at 1 p.m. where Tina Patterson from Homeful will give a presentation on some of the great work that they're doing in Dayton. Thank you again for joining, and hopefully we'll connect again next time. Thanks, Zach.
Thanks, folks.